as we start to move more to biologic agents, there's no doubt about it that this past ASCO, the ANANOVA data was utilized in patients instead of using chemotherapy. So these patients were randomized to niraparib with bevacizumab versus single-agent niraparib. And what we saw in that patient population is that you can substitute biologic therapy instead of chemotherapy. Again, combining it with Avastin, you had to bring the patient in and they had to have some chair time to get their infusion. I think one of the nice things about PARP inhibition is it's an oral drug. So if you have a patient who has an excellent functional status who doesn't want to be coming in for chemotherapy infusions, say their blood counts are fine and they want to get their medications, and then, I live in Pittsburgh, say they want to go down to Florida, so they can fly down to Florida, we can check their labs while they're in Florida, and then they can have their medications refilled and fly back once a month, once every other month to have their medications refilled and to make sure their toxicities aren't there. So to me, I think it releases them from the chair time. A lot of these side effects are managed over the phone with our nurse and the PA to help in taking the medication in the evening. I think helping fatigue with medications to help with fatigue are all positive interventions. So to me, I think chemotherapy has side effects. PARP inhibitors have side effects. They're different profiles, and so to me, it's a nice alternative for the patients, and I think it gives them choice. And really, to me, I think when we're interacting with a patient, the more options and choices we have for those patients, I think that sounds odd, but that's actually comforting, knowing that if this doesn't work, we have this, and if this doesn't work, we have these choices. So the patient doesn't feel pain in some corner and say, this is my only option at this time. I have these other options. I kind of like how this sounds. I can take a pill for a while and not have to worry about chair time, and so the patients are doing well. And again, I think this is a conversation that each patient's going to have, and I don't know, it's what I always tell the residents. The science of medicine is understanding the Topazio data, the Quadra data, the ANANOVA data. It's the art of medicine is applying that science to each patient, realizing that, I saw 4 patients today, and each of them are receiving treatment for recurrent therapy, and each are slightly different. And that's just because that's what the patient said, hey, this works better for me and my lifestyle.